We'll now walk through a brief demonstration of the access controls and sensitivity protection capabilities of PHEMI Central. Let's begin by taking a look at the data. This is a set of fake data that was generated for the purposes of this demonstration, spanning several different variables of interest. We have, for instance, the patient health number, the first name, last name, birth date, city, various different metrics associated with blood pressure, as well as some clinical information for individuals. Importantly, you'll note here that we have also got specification of the sensitivities of the data in the system, as denoted by the highlighted line here. For instance, the personal health number is being dictated as being PII, or personally identifiable information. The names, birth date, and city of residence are also similarly tagged. We also have some confidential information relating to the education level of the individual, as well as non-personally identifiable information such as their blood pressure values. And finally, some clinical information too pertaining to the diagnosis of the individual. In PHEMI Central, we're able to configure access policies that dictate who can see what versions of this data, or possibly de-identified versions of this data, as we'll see shortly. We'll now meet our various different users. We'll begin with Michael. He has the public authorization, which is the default authorization provided in PHEMI Central, that's going to give him access to a limited amount of data. We also have Alice, who's a policy analyst, who will have access to additional fields of information, but only in a de-identified form. And lastly, we have Rachel, who's a researcher, who with this authorization is going to gain access to the PII values within the system, as we'll see shortly. Moving over to our dynamic querying of the system, we see here three different users, Rachel in the top panel, Alice in the middle panel, and Michael in the bottom panel, doing queries against the PHEMI Central system for data to support their analysis. Rachel and Alice are both querying for the same fields, but as you can notice here, Rachel, due to the fact she's got the researcher authorization, gets access to the PII values within those fields, including the birth dates being exact dates, the total postal code, the education, and the last name values, in addition to a couple of metrics associated with blood pressure. Conversely, Alice, who's asking for the exact same data, same fields, she only has access to de-identified versions of this, including the truncation of the birth date to the first of the year. The last three digits have been set to default values for the postal code, and the last name has been blanked. Lastly, Michael has access to only a restricted set of the fields, including just the postal code in a de-identified format, as well as just the ICD code associated with the clinical analysis. This demonstrates how these dynamic access controls can be used to protect access to data within the system while making it simple for users to gain access to the data they're allowed to have.